I want to introduce you guys to tonight's guest. And I saw you on here, Dr. Lamb,
Mhm.
and I want to I want to start by reading your bio, just to kind of go there, and then we're gonna personalize it a little bit. So just so you guys know, so I'm gonna so Dr. Lamb graduated with a Bachelor of Science in Fine Arts from Pacific Union College. That's where we met. Um, and earned her doctorate of medicine degree at Loma Linda. She's board certified in family medicine and anti-aging and regenerative medicine. She's completed her fellowship in anti-aging, metabolic, and functional medicine, and is a graduate of the Institute of Functional Medicine's Applying Functional Medicine in Clinical Practice course. Her career focus is in primary care, along with functional and integrative medicine, with emphasis on anti-aging, lifestyle medicine, and nutrition. She won a medical scholarship award for preventative medicine and is an author of the international best-selling books, Advanced Symptoms of Adrenal Fatigue Syndrome, A Metabolic Approach, and Adrenal Fatigue Syndrome Cookbook. She also co-founded the Lamb Clinic and is the medical director there, and has a wealth of knowledge, but overall is just a really cool person, guys. Down to earth, great friend, and just incredibly knowledgeable and willing to kind of share that knowledge. And so that's why I asked you to be a guest tonight, because the accessibility to information, I think, is what changes things. And so
Right.
so thank you for being willing to join us tonight in Wellbeing Wednesday.
Thanks,
Um,
Kat, for having me.
Absolutely. And so I want to start, before we get into tonight's the topic. Being that this is Wellbeing Wednesday, I want to personalize it a little bit. So, what is something that you do to promote your well-being?
Yeah, so I think I'm really big into well-being. So yes, thanks for the intro. I think what uh, really constitutes well-being is not only it's a mindset, right? I think positivity and looking and being fulfilled in what you do will also contribute to your well-being. Like, do you love what you do, or do you kind of go to work and you're like, oh, I have to go to work because I have to go to work? So that mindset of I it's not I get to go to work, but I want to, or not I have to go to work, but I get to go to work. So as for my well-being practice, I have quite a few, but I think Sabbath rest, I think, is one of the biggest things I can advocate for. I think going through college, going through medical school and residency, I never once studied on Sabbath. The Sabbath day. I think I always set that aside, not only from my upbringing, but just for my sanity, um, that that my brain needs that rest. And so the rest from work also is very important that God set aside. So I feel like that's very important, for my well-being, or else I would go crazy. And I think in medical school, we also had these what we call golden weekends, which is after finals week, you get 2 whole days off, compared to just one day. And that was even like, just so much, what we call it is like you work hard but you play harder. So something to look forward to. I think that's very important. The other thing that I actually did a lot of is sleep. You would think that, oh, I have so much to do, I should study more, or I need to catch up on everything, I'm going to sacrifice my sleep. But no, like if I got less than 6 hours of sleep, I would just get sick like instantly. So I slept at least 8 hours, yes, every night, um, for my own health. But I think also because your brain needs that sleep to be able to process everything and package it into your memory. And the healing also comes in the sleep. So unlike so many people, who rely on caffeine because they don't sleep very well, I actually like rarely drank coffee, even through my medical school days, and even now I rarely drink coffee. Um, And that's not to say that I don't believe in coffee or things like that, but usually coffee is used as a crutch because you are tired. So how do you prevent yourself from being tired is by, making sure you get enough good sleep to begin with. Definitely eating healthy is part of the well-being. I think a lot of people know that. Half your plate should be vegetables, like legitly at every meal. So that's just a general thing that I would say. And um, setting aside time to do what you love, what I love to do. I love to hang out with friends and family, church family, community, and I love to do art. Tad knows this. So,
Yes.
and then purpose and fulfillment. I talked about this in the beginning, but finding what fulfills you in what you do daily. For me, maybe it would be helping to heal patients, but not only in a physical way, but spiritually too. So that's how I find fulfillment in what I do.
Huge. And I think it's worth noting, right? Sometimes the idea is well, it's easy to say until you're really busy, right? So it's like it's so easy to say, okay, set time aside for this, or set time aside for sleep, or set time aside for a whole day where you're not going to do anything. Um, and the excuse is, well, I'm probably busier than you are, right? Um, but it's very interesting that, with everything that you've gone through, that's busy, right? Like starting a new
Yeah.
practice, medical school, residency, all of the things it takes, that is extremely busy. And I think as you enter into these spaces of higher productivity, the rules are more important. um, it's actually it's you can I don't think you can function at the highest areas
Mhm.
without truly paying attention to those rules, because the burnout will be that much worse. Um,
Definitely.
and so I do think it's powerful just to mention that it's coming from someone that has been through the busyness, and it's not a sacrifice of how much you need to get done. It's actually how you get that stuff done.
You're right. Yeah. If you make it a priority, you're not going to feel like you're missing out. It actually just relieves you. You have those rules set.
Yeah, that's awesome. So we talk a lot about purpose being a foundation of well-being, in Well-Being Wednesdays. And so I wanted to ask, just kind of start with a purpose story. I think a lot of people, we've talked about it as students, but a lot of people have been felt a calling, or a family member or something that led them into healthcare, or the wanting to serve people. And so, being that you currently are the director of your own clinic, and started the Lamb Clinic, is there a story behind how you ended up in that current role, or how you ended up in medicine in the first place?
Yeah, definitely. I'm one of those people that say I've always wanted to be a doctor, ever since I was young. And it it stemmed from my father. He was also a medical doctor who went to Loma Linda. But he ended up actually coming out and doing integrative medicine. He's been doing nutritional coaching basically for the past 20 years, all over the telephone, and decided decided to go the natural route. So even though we've been trained conventionally with the medical school and to be an MD and be able to use medications, we decided that our philosophy on health is to get to the root cause. And so seeing him practice and help a lot of different types of people, the people that he's seen is usually people that have gone to 7, 8 doctors, have not gotten their answers, really jaded by the medical system, and are really desperate for help, whether it's alternative help or any type of help. And so having seen him help people, I obviously wanted to come out and, you can say, help these people, but not only conventionally, but in a whole person type of way. And so just knowing that, I went through medical school and residency, knowing that I wanted to come out and have my own clinic to be able to help these type of people, because I could see that in conventional medicine, it's not really possible to do that type of medicine yet. Okay. But hopefully in the future, we will be able to. And so if you don't know what functional medicine is, I can just give a quick rundown. So functional medicine is to get to the root cause of why symptoms happen. Medicine, as we know it now, a lot of times is covering up symptoms. For example, someone has diabetes and we give them metformin or pills or insulin to lower their blood sugars. But do we stop to think about why their sugars are high in the first place? Do we take the time to counsel our patients on diet, on lifestyle changes, on exercise, which could be what is causing their diabetes in the first place, correct? And so, but a lot of times as we go see the doctor, oh, you have high sugars, you need to take this pill in order to lower your sugar. And that's more like sweeping the dust under the carpet. So with functional medicine, we try to, get to the root cause, what is actually causing the diabetes or any chronic disease, okay? Integrative medicine is the toolbox, I like to say. You have regular, yes, medications are definitely good. Like you go to the hospital because acute care is great and surgery is great for keeping people alive. But then what about chronic diseases? There are a lot of variety of options that are open to people and to patients, not only medications. There's nutrition, there's natural, there's alternative, there's Eastern, there's Western, there's a lot of different therapies. And so integrative medicine is the toolbox for all of that. Because each patient should be personalized in their treatment and not algorithmized. So I'm really, passionate about that when patients come to see you and they have issues, they are a person and they are not a disease, right? So figuring out what their root cause and how to help each individual person where they're at is very important. And then there's also preventive medicine. So we want to focus on healthcare. It's called healthcare. It's not called sick care, right? We hear that a lot. And that nowadays we're doing sick care because everyone is sick by the time they come and they see the doctor or they see the nurses. And so what we should be doing is trying to get people healthy before they're even symptomatic, before they come see the doctor, before they get to the hospital. And so at our clinic, we do a lot of elite workups. We really want to make sure that they are healthy long-term and they age gracefully, you can say that. So it's quality of life. But I also know that, yes, burnout is very, very real. And I would say in residency was probably the hardest time for me for finding my meaning in being a doctor or in seeing patients. And a lot of times I would say it's not the persons, it's more the system that we're in, right? We are just thrown in and you're expected to meet numbers, you're expected to see these amount of patients and do what the hospital tells you or do what the clinic tells you, and you say like, yes, sir, and you just do it, and so that part of wanting to help people, we can lose sight of very easily. And I can say that if we want to help people, we have to first help ourselves, right? So when you go on an airplane, they tell you put your mask on first before putting it on your child, because if you're not doing well, you won't be able to help them. Same thing as a healthcare provider. You want to make sure that you are personally well, or else you won't be able to take care of the people that you're taking care of. Does that make sense?
Yeah, that's powerful. And I think honestly, that's the basis of Wellbeing Wednesday. If you're gonna step into the field and a system that might not be fully ready to promote well-being, and I think unfortunately we've seen that over the last several years. It's a tough system to be in, and it's there for a purpose, but when out of whack, it can create its own issues. And I think it's, someone put in the chat, inspirational. It is inspirational because, as a nursing model, it's like whole person care, seeing a person as a whole. And we hear that a lot. And then sometimes we see something that's a little bit different. which can also contribute to a little bit of the burnout or compassion fatigue, which is, hey, I came into this profession to help people, and I don't know if I'm really helping people. So it isn't, and at the same time, I feel like my health is worse than when I started. so, so I think it's inspirational to hear, and hopefully that the system of healthcare with funding models and changes in structures of how you pay for healthcare promotes more of that preventative model and more of the whole person than just patchwork. So that's super inspiring. So I want to get into, okay, so that's kind of the macro view of what you're doing and your philosophy behind medical care and preventative care and functional integrative medicine. And I wanted to focus kind of on what I would, and maybe it's an assumption, I'll let you correct me if it is, but adrenal fatigue syndrome is kind of one of your clinic's expertise. You guys have written internationally acclaimed material, books on that subject, and it's really connected into the concept of stress and adrenal fatigue syndrome. And so I wanted to spend kind of a little bit of time connecting those two topics and really, getting into your expertise in this, because everybody in this room or on this call, on this virtual room, is going to be in a constant stressful environment, right? Healthcare is a constant stressor. Each student probably feels like they're under an immense amount of stress already, just with school and studying for exams and not having enough time for anything. And so stress is this inevitable part of life, but probably more heightened in this group, in a group of healthcare workers, than anything else. And so, like, just to build the foundation of this, what is adrenal fatigue? And then the part B of that question would be, what's the relationship between stress and adrenal fatigue?
Yeah, great questions. So stress, we know, affects our whole body. I will start off by saying that adrenal fatigue is not a medical diagnosis, meaning it's not recognized by the majority of the medical community. But if you go into the integrative and functional world, everyone knows what adrenal fatigue is. So what does it sound like? Your adrenals are tired, right? So what happens when your body undergoes stress? The stress response, we know now, primarily most people know about the HPA axis. We call it the hypothalamus, pituitary gland, and the adrenal gland. So let's say you see a tiger, what your brain does, the hypothalamus produces this corticotropin releasing hormone to tell the pituitary gland to produce adrenal corticotropic hormone, ACTH, which tells your adrenals, okay, you need to put out epinephrine and norepinephrine, okay, if this is like an acute stress. Epinephrine and norepinephrine, as you know, can be, it's there to really ramp you up. It's adrenaline. And so you're there to run away from that tiger. So it's compresses all your blood vessels, it gets your heart pumping really quickly, and that's that stress response. And then your body over time says, well, I don't need this long term, because imagine if your heart was pumping all the time really fast and that would not be good for your health. So it also releases, your adrenals release cortisol, okay? Cortisol is there as an anti-inflammatory hormone in order to reduce that stressful response that epinephrine can produce over time. And so if you think, what is cortisol? It's basically steroids. And steroids are anti-inflammatory, right? So like if you think, oh, someone has asthma, I give them steroids to reduce inflammation. That's what cortisol is in your body. The steroid to help reduce inflammation that stress causes. And so over time, let's say it's not just you see tiger, but your boss is yelling at you, and not only one time, but every day. Or you're studying for tests and it's not just one time, it's every day. So stress tends to just accumulate. Even perceived stress accumulates in your body to release more and more cortisol. And over time, we call it adrenal fatigue because we've seen in saliva tests that the cortisol actually drops. Your output, your adrenals output of cortisol just gets tired over time and doesn't want to produce cortisol. Kind of like how in diabetes, it doesn't want to, the pancreas doesn't want to produce insulin anymore. And so what are the collection of symptoms? In the name fatigue, right? Adrenal fatigue. You can feel really tired chronically. You can have hormone imbalances, whether it's in women like PMS, or you can have heart palpitations if it's affecting your cardionomic system. You can have weight gain or weight loss if it's even worse. You can have a lot of gut issues. So a lot of these symptoms can be very vague, but there's that's where I come into this neuroendometabolic stress response. Now I know that, stress does not only affect your adrenals, but it affects your whole body. When you take that test, when you're about to ask that girl out, you get butterflies in your stomach, right? So stress also affects your gut because cortisol can make your gut a little like knotted up. Okay, so I like to see that stress is broken down, and it affects both the endocrine, which is the neuro is the brain and the nerves, the nervous system, endocrine is hormones, and then it also affects your metabolic side, which is your energetic, your detoxification, and also your inflammation circuit. So I've actually come up with this model of 6 different circuits that stress affects. And depending how stress affects your body, it can actually affect the different parts, and you can have different types of symptoms that come out. And so the question is, yeah, stress does affect the human body, and it affects so many different types of ways, right? And how do we help it, correct? And that will be a lot of different things. So I said that adrenal fatigue is not a medical diagnosis, but actually chronic fatigue can be a diagnosis that's a medical diagnosis. And so chronic fatigue basically means that you've had fatigue for more than 6 months. That's how you can diagnose chronic fatigue. And if you've had like lightheadedness when you bend down and come up too quickly, or if you have decreased exercise tolerance. I see a lot of patients with adrenal fatigue. They can have brain fog. They can have sugar changes, meaning after you eat, you get hungry again really quickly. You can have low libido. You can have mood changes, gut changes. And so if you do, you definitely want to be cognizant of it. In the beginning, it might just be 1 cup of coffee. You're like, I'm tired. I wake up tired. I'm going to drink coffee, and then over time, you're like, okay, 1 cup is not enough. I need 2 cups. I need 3 cups. Or I start having palpitations, or I start being really tired despite drinking the coffee. Then you kind of have to dig a little deeper if there's something underlying all of these things. Stress is a big one. Okay. Does that make sense?
Absolutely. And so here's my follow-up question to that, right? Because we're all going to be in a stressful environment. So everybody's going to operate within this stressful environment. And I think that's one of the reasons, like you talked about at the very beginning, balance being such an important thing, sleep being such an important thing, a day off being such an important thing. And one of the things I always say is don't do extra shifts ever. Like never do an extra shift. If you need more money, figure out a side hustle that is not in the hospital. But I truly believe that. For a group of people that are gonna be, for the majority of their careers, potentially sleep deprived on night shift, or potentially in these stressful environments, is it doomed to the negative impacts of stress, or is there a protective mechanism against the negative health impacts of stress or this adrenal fatigue?
Yeah, you definitely want to tackle the root cause, right? But there are ways of dealing with stress. Like you said, not signing up for extra shifts or learning how to set up your boundaries. A lot of times we are such go-getters, we can't say no. I know that's me. But people with adrenal fatigue are usually type A personalities. They're successful. It's because they burn themselves out, always saying yes, always people pleasing. So there are tools like learning how to say no, like um, for me, it's my husband. He really helps me basically say, no, you can't do that. Or so maybe that's an accountability person for you. Or one tool that I use is like, oh, I'm sorry, I already have something on my calendar. And it's the word something. So I'm not lying because there's always something on my calendar. So learning to set aside your time and your boundaries. Hey, is this a priority? Do I need to do this now? Is part of the stress management. As you go into the hospital and as you see patients, right, and as we become very busy, the it is going to be stressful, right? But what are some of the tools that you can take with you, even when you are busy and stressful? So one, for the stress response, is breathing. Okay, breathing exercises. As we know that the the HPA axis is more of a sympathetic response. Sympathetic meaning fight or flight. Okay, and then how do we help the parasympathetic out with the rest and digest? The best way is breathing exercises. And what kind of breathing? You got to be careful because even deep breathing can stimulate someone. I've seen that. So it's more of a calm 70% of a breath, abdominal breathing, where you actually get the abdomen out. You're bringing the diaphragm down because that's where your vagal nerve lies, very close to your diaphragm. So when you're moving that, you're focusing on your breath, you're meditating or having some mindfulness, even in between patients. That's one way that you can kind of clear and set your purpose and your intention, and also bring your parasympathetic nervous system up. So you're not always in that overdrive, that HPA axis overdrive. Another tip that I really, really enjoyed, or you can say I really thought helpful when I was in residency, was love rounds. Have you guys talked about love rounds before?
No, we haven't.
Oh, okay. If you guys don't know what love rounds are, it was started by Dr. Will Alexander and Dr. like Harvey Elder. And so love rounds is where you would pick one patient a week to set aside maybe 30 minutes or an hour of your time to just sit down and talk to them as a person, get to know them, see who they are and what brings them joy or what are they famous for. And so us as a family medicine residency team would pick one inpatient patient to actually go and talk to for 30 minutes. You can imagine we're so busy all day, but we literally set aside, well, it would be like 1 hour of our time, basically. We have one person go sit by their bedside and we talk to them. And Dr. Will Alexander always loves to open with, what are you famous for, right? And the patient's like, well, what do you mean? I'm here in the hospital. But no, we want to get to know them. We preface it like, hey, we're here to just talk to you and love you as a person. And it not only brings so much meaning to patients, but also to the team, to know that the person that you're treating has a family, has a dog at home that they're missing or something, or 5 cats. And they are very proud of what they've done, or their 60-year marriage or something, because then they just light up. They're a whole different person. They're not just a patient in a hospital gown in the hospital for an acute reason. So that really changed my you can say like daily flow, in that I would be looking, hey, is there a patient that I can actually directly impact every day or every week, because we day to day in the flow of things always, we get busy. We tend not to think of them as patients anymore. We just say, okay, well, this patient is here for so and so and so and so. And so it was very good to, I guess, ground me. And so if you, as nurses, nursing students, you have time. So don't say you don't have time. Okay. So everyone can make time, find that one person, that one patient that you can impact, that you can just sit down and talk to. And you'll be surprised how much meaning you can bring, not only to them, but to yourself, because you'll be like, the way we also did it, we offered prayer at the end. We would ask them if they would be willing to, and 99% of the time they would say yes, and really appreciate it. So I became comfortable with praying with patients just from doing love rounds. I thought that was like one of the best trainings that I got, because I don't think you will get that anywhere else but in Loma Linda. So I'm very grateful to Loma Linda for that.
That's incredible. I don't know how I knew about Will Alexander, but I don't think I had heard of it as the love rounds. But in the emergency department, that's the one thing that kept me from getting jaded. Was sitting down whenever I could and asking people their stories, and it brings a thread of humanity into a place where there's a lack of it a lot of times, and it reminds you of your own humanity. So it's a very interesting. I mean, that's amazing advice. Those three things are huge. So hey, I wanna let's go through the chat. You have a lot of people thinking they have adrenal fatigue syndrome now. And then I want to go back to the first one. Could not wanting to socialize or leave the house if remote working be a symptom of adrenal fatigue as well?
Well, so I would say many people deal with adrenal fatigue. Just depends on the stages, right? Of where you are, because there's 4 different stages. In the beginning, yes, you could have the wanting to stay home, not wanting to leave house. It's more, that might be just a mood issue, okay? But it's always good to get down to the underlying cause, because I always look at, whether it's depression or anxiety or any neural issues. I feel like those are symptoms. Okay, I'm depressed. How is depression an actual diagnosis when it's actually a symptom of something underlying, whether it's, serotonin imbalance or a gut imbalance, or maybe your hormones are off? I always try to see what the root cause of those mood issues would be. Okay, and then basically adrenal fatigue, like I said, it's more symptomatic diagnosis, but there is testing to be done if you're interested. They're not usually covered by insurance. Okay, it's a saliva test, and so the saliva cortisol test is what I would usually do for just getting a baseline look at how your adrenal function is, because it tests your saliva 4 times throughout the day. So when you wake up, at noon, at 6 p.m., and at nighttime, because you kind of want to see the whole curve on how your adrenals are producing cortisol, not just a one-time blood in the morning. And so in conventional world, a lot of times they see the cortisol, it's either going to be super high or super low, and you only have 2 adrenal diagnoses, which is the Cushing's or Addison's, and there's nothing in between. And that's where adrenal fatigue kind of falls under. It's that in between that stress affects, and so it's not only just the extremes. So what I do, yes, we see a lot of people that are on the outskirts of the bell curve. We're not just the 95%, but we do see people like that at Lyme Clinic. Tad was talking about how we can change the system, right? Because it's the system sometimes that we get burned out in. And so that's why I chose to open my own clinic, Lamb Clinic. We're located in Tustin, Orange County, so not too far. And I decided to be to open my clinic to be able to change the future of medicine, right? Decided as a functional medicine provider not only to take cash patients, but to take insurance patients, because I want to be able to provide a model where functional medicine, integrative medicine can be for every clinic out there or every hospital out there, and that we should be focusing on prevention. And how do we change the whole system is by really producing this model and keeping patients healthy. And yeah, if you're interested, look us up. You can always, contact me. I think Ted, you can give them my contact if you want. And come out to our clinic if you want to be a patient or if you want to learn. I think, yes, education is key. So read as much as you can as healthcare, and take care of yourselves. I think that's very, very key too. That's what we're all here to do.
Thank you so much. I have to think about the amount that can change if you put these things into practice before you're burned out. There's such a difference in, everybody sits in that classroom the first day and you're only inspired, right? You're like, I can't wait to go help people. I can't wait to go change people. And then everybody works with that one healthcare provider that's like, how did they turn into that? And most likely they were one of the people that was sitting in the classroom inspired on day one. And so I think it's so important to protect it and understand that there's a science behind if you don't take care of yourself, if you don't rest, if you don't sleep, if you don't do that, and you just go, there's a science behind what will happen. It's not random. It's not haphazard. Like there's a systematic way that your body will respond. And I think with everybody being in healthcare and wanting to help people, you're patient zero. And so really putting these tools into place for yourself will allow you to take care of exponentially more people than you would if you just got burned out year one. So thank you for the information. Thank you for dropping knowledge and just being, truly changing medicine, changing the world. It's a privilege to call you a friend. So thanks for being a part of it.
Thank you for having me. I wish everybody blessed night.